Hi guys, so excited to see you all. It's been about a year and I haven't posted, so just wanted to make sure I post, I inform you about my progress. We want to discuss some of the new learnings I've had, and I really want to mention how I've changed my protocol and regimen. I know a lot of you are still suffering from symptoms of hyperadrenergic activity in your bodies or high blood pressure. Also, arteries, right? So we want to talk about how arteries, accumulate plaque and how I've learned to ensure that I have a zero calcium score. Okay, and your LDL and other triglycerides and all of the other components that come into play with aging. Okay, so I'm going to share my current stack, my current protocol, and I also just want to make sure that I say that this is not medical advice. This is things that I have learned. It is imperative that you speak to your doctor and kind of have their advice before you start any of the stuff that I'm doing. Okay, in my previous videos we really heavily focused on hyperadrenergic postural tachycardia. Let me be happy to say that for me right now, that is not an issue. I have not had any norepinephrine surges in a while. And the reason for that is that I am currently on a very interesting medication routine. And let me start by saying that there is no miracle cure for our condition. There's no miracle cure for high blood pressure. You do have to understand what works for your body. But there is something that, when you look at your artery score, when you look at, you get a PET scan, you get some sort of CT scan, and they say, hey, your arteries are 70 years old and you're only 40 years old, You've had a bad diet, or, your body's not responding, you have hypovolemia, you have some sort of issue going on. You kind of might find yourself confused. Like, how do I reverse all of this? Do I take vitamins? Do I kind of start eating a different diet? But there's so many different components that come into play that are unique to each individual. So for me, and I think I mentioned this in a previous video, angiotensin 2, which is what causes vasoconstriction. This is a chemical in your body. It's called angiotensin 2. You can look this up. That's what raises your blood pressure. It's one of the components in your body that causes vasoconstriction. And there's something called the ACE inhibitor and an ACE blocker. So what I use is an ACE inhibitor now. This is part of my current regimen. It is called Ramipril. Okay? This might give you tachycardia on a very slight, so your heart beats per minute, if you have POTS, is already going crazy. So if you're hypovolemic and you have low blood volume, this might make your heart rate go even higher. So you have to be very careful, okay? But if you are experiencing adrenergic reactions and your blood pressure is spiking randomly, significantly, Ramipril will prevent that from happening in the beginning stages. So you will not have that precursor that angiotensin inspired, because angiotensin combines with adrenaline and they cause a boom, big impact, pheochromocytoma-like increase in your blood pressure. So you got to be very careful to not be hypovolemic. So you have to drink your salt if you have POTS. You have to drink your water. You have to ensure you're not hypovolemic if you're going to take Ramipril. Ramipril reverses atherosclerosis, reverses plaque in your arteries. It also has an anti-inflammatory effect, which ACE blockers like telmisartan do not. So if you have high blood pressure, you need an ACE medicine that makes sure that you don't produce angiotensin 2, you want to be on Ramipril. Now, I have been on Ramipril and I wasn't on this before, okay? And it has done a wonder on my BP numbers. My blood pressure nowadays does not spike, even in activity, okay? So every time I measure my blood pressure, it is 120/70. That is significant compared to before when I was happy with 140/90. Okay? So let's also talk about another medicine. And I believe I mentioned this. It's called clonidine. Okay? So that is an alpha 2 blocker. This medicine works in your brain. So the way clonidine works is it actually inhibits norepinephrine. So it blocks norepinephrine in a way that it doesn't hit your vascular system. It doesn't hit your overall body in a way that produces more norepinephrine, right? So that you go into a surge. So it doesn't affect heart rate per se. It can cause bradycardia, which is a heart rate lower than 60 if you take too much of it. Or there might be something called a reflex. So there's a reflex because you have baroreflexes in your body, right? So your body controls homeostasis. So if you're lowering your blood pressure too much, your body's going to start raising your blood pressure and lowering your heart rate, which is very bad for you. So what you want to do is ensure that you're finding homeostasis, which is why it's important to be monitored by a doctor, a medical professional, so you don't go overboard. You always want to start smaller, right? So you kind of build up a regimen. Okay, so ensure that if you're going to go on clonidine, just realize that it's a very powerful, it's like a fourth line medication, and it's reserved when other stuff hasn't worked. But it does have a very profound effect on blood pressure. Okay, so that controls the alpha 2 receptor in your brain, in your vascular system. So your body is actually not producing as much noradrenaline, norepinephrine, which is what the main culprit is behind our blood pressure spikes. Okay, so now we have Ramipril, we have clonidine. So we have a two-pronged attack, one against angiotensin 2 and one against norepinephrine. You also want to ensure that you don't panic, okay? Your mind controls your body's response a lot of the time. So sometimes it's very important to ensure that you're not adding on extra anxiety. Sometimes you go to the emergency room, they'll be like, you have anxiety, you need medicine. They'll pump you full of, I don't know what they use nowadays, but some sort of benzodiazepine, right? Or they'll give you a little bit of Valium or clonazepam. That is not an answer. GABA receptors build resistance very quickly. So being on a benzodiazepine, unless it's an emergency, is not a good idea. My recommendation is sertraline. So you want to go on a very low dose of Zoloft. I think that there was a research paper done on Zoloft, and it's interesting that 25 milligrams, and I could share this in my notes, of Zoloft reduced hyperadrenergic spikes. And that's amazing to know, because what we want to do is reduce as much hyperadrenergic spikes as possible. So when we combine a serotonin receptor increase, actually the way that Zoloft works, it contains, it stops serotonin from being broken down in your system, right? Because serotonin competes with adrenaline and other components, right, in your brain. So if you have more serotonin, you're calmer. You're more resistant to anxiety. So it's imperative to, understand that your body becomes more used to having more serotonin and keeping you calmer. So I think it's another component of this homeostasis that I was talking about with clonidine, Ramipril, and serotonin that has really given me a combination of full control, of full balance in my body. So these are things that I'm more than willing to answer questions on. I would love to hear about your experiences. If you guys are taking any supplements, we have a huge POTS community in Reddit, and I think that there's a lot of very interesting advice going around. But for those who are experiencing blood pressure spikes, it doesn't matter if you have POTS or not. You're experiencing blood pressure spike, there's something going on, whether it's insulin resistance, some sort of other issue. It's important to discuss it. It's all for longevity. Thanks, guys. I'll record something soon again with the remaining protocols and medicines that I've learned about, and I look forward to seeing you soon. Bye.